recording now, so
okay.
Everybody, Chris DaPrato, Myofascial Decompression, at Cup Therapy on Instagram.
Yes.
And we'll put a little title that goes at Cup Therapy right there.
Sounds great.
Right. What the cup? Right?
Yeah.
Yes. What the
Hashtag
cup.
What the Cup.
Hashtag Beyond Cupping.
Yeah.
Cupping can get you in trouble, so watch out. Cupping leads to spooning. Spooning leads to other things.
Yeah.
Slippery slope.
Yeah. It makes me think of the pool scene yesterday at Happy Hour.
Absolutely.
Man, it is
So
getting wild.
great class. I mean, what an awesome venue. What an awesome experience overall. But just seeing everyone with their marks afterwards and people coming up to them and asking, "Oh, hey, is this part of the all-inclusive package? Where can I go get this, service done as well?" Because we're here at this all-inclusive place, and we were just laughing,
Yeah.
Half of them stumbling around because they've had way too many cocktails already.
A lot of drunk people around here.
Yeah, a lot of drunk college kids.
Yeah. What do you think about the class? Because I felt like the class itself, I think JetSet sometimes has an image like, everybody's just going to party. Nobody does a class. But what were your thoughts on the engagement?
I was very happily surprised. The engagement level was very high. And I thought the level of clinical reasoning discussions that we had was, top tier. I really get somewhat, I think, bored in classes sometimes because I'm teaching the same material over and over and over and over again. Like we've taught this course 255 times. So we had a raffle at CSM San Diego to say, how many courses have we offered? And so that was the answer. That's why I know that number inside and out right now, because just a couple weeks ago I didn't know that. And so when I get a group that asks new questions or challenges the status quo or challenges even some of the concepts I present based on other information they've read or other courses they've had in their past, I love that discussion, and I love the ability to get into the nuance of clinical practice because nobody has all the answers yet, right? Evidence is evolving rapidly, exponentially, and we all are trying to just figure it out the best way we can. So I thought the course was so much more engaged, so much more, I think, fulfilling on both ends of the experience here at this great place, and you get done with class and you jump in the pool and, get your cocktails. It's fun. It's great. Yeah. But in the class, I was very surprised and shocked that the level of just people paying attention and getting engaged in the discussions was really high. It's really great.
Yeah, that's great to hear, because I think that's the it's hard to get that across on social media and stuff like that. Yeah, it's just like, hey, this is a real class, and we're not just partying all the time, because most of the people, they don't take photos I'm studying,
Yeah,
so exactly. they tag us on Instagram and stuff, and it's just margarita,
totally.
So people, I'm glad you said that. And I think I was telling you yesterday, but Claire Frank took us aside. Remember when we were in Thailand last year?
Right.
And she was like, "Hey guys, the class is paying attention, so I am going to change the lecture."
Yeah. She leveled it up.
We told
more,
you, Claire.
Right?
Yeah. And she's like, "I'm dialing it up." She went totally different PowerPoint. These people are very smart, engaged, and let's challenge them a little bit.
Yeah.
So.
I mean, it's unique in that sense, right? People are generally engaged, and then the other aspect of it is, then you have the other aspect of it where they do get to hang out after class.
Yeah.
And a lot of them are just hanging out together, or they're bringing their significant other and just having a good time.
Absolutely.
I mean, it is kind of strange. Yesterday we noticed all those college kids, but I think it's the time of year we're here. We got here right before spring break's about to start, so I think we started to notice the first effects of that yesterday.
People watching was excellent.
Yeah. It's a backflip off the bar.
Yeah, but I think there are a lot of misconceptions. Like my course, people come in thinking it's just a manual therapy course, and it ends up being an entirely different experience because we're all about movement. We're all about therapeutic exercise.
There you go. And fatigue. That's called failure. That's what
movement. We're all about therapeutic exercise prescription, and you have to pair those things together. So I think we love kind of getting rid of these misconceptions that people have, because we all have biases, and we just we catch the small phrases of things or the exposés of things on Instagram, and you don't really capture the essence of what's really going on. And this is a high quality, highly engaged group with JetSet that I think, anywhere they go, you're going to have a really good quality class. So I would definitely come back and take another course with you guys, as well as offer some other courses.
And everybody that took the course got one of these. It's like a precision pump, electric precision pump.
So it's the first time a pressure gauge has ever been attached to a manual therapy pump for cupping. And so to have a pressure gauge, you just get much more specific on the actual layer that you're trying to have an effect on, right? So there's certain layers. If you're just trying to have effect on lymphatics, there's a certain amount of pressure documented in the literature that is there for you to stay within to be optimal. And so to now have a pressure pump on a gauge, we're really trying to change the game and make it as objective as possible. Because before it's like, let's light a fire in this glass cup and stick it on there. Well, what the hell kind of pressure is that? Or even the manual pumps, like how many pumps are you using to try to get down to the multifidus when you're trying to treat someone with chronic low back pain? So we're really trying to change the game with an objective measure and trying to make it as repeatable as possible.
Mm-hmm. I will say that the cool thing about your class, like you brought up earlier, a lot of people think it's like a manual therapy, or maybe just a class where it's like, oh, I'm just going to learn how to cup, right? But I really appreciated like all the anatomy you bring, and just all the basics, and a lot of the the background and the research behind it. And you've done some research yourself, and you shared that with us. I found it really insightful. I did. And then the cool thing was actually, as we were going through the class, it was just like sparking like these ideas in my head. It's like, oh, I could use this with this exercise, and I'm kind of the kind of person who likes to get the most bang for my buck. And it's like, if I can do multiple things at once and get multiple effects to get the patient better sooner, then I'm all for it. So I think that's part of some of the take homes which I saw with this course. It's like, you can utilize this with some of the normal exercises and things that you do with your patient, and you're getting an additional or added effect.
Yeah, I tell people, take what you do and just add this in a little bit. If you're PNF trained, use your PNF patterns and put a cup where it's more densified. If you're Kaltenborn trained, use your Kaltenborn patterns. If you're parasite trained and you're a parasite, like, go do the things that you generally do. If you love lifting and CrossFit, do your CrossFit workouts, but every now and then put a cup where you're having some discomfort, or we're having some thickening of the connective tissue, which we like to call densification, and just add it into there, right? So whatever type of movement science training you've done, whether it's Sarman or movement links or some type of fellowship, like, you just throw this in the mix, and it doesn't change much except for speed up the outcomes that you're trying to achieve. And so that's what we love about it. It's just this little anecdotal like component that you throw into there that drives this thing that we're trying to figure out with the bridging of manual therapy and exercise together to create better functional gains in people.
Yeah, I mean, for me, it made me like excited to go back to work, because I'm like, I can't wait to do. And the other thing is working in a fast-paced environment, like where we do, where you have like 30-minute follow-ups. It's like you can do strengthening and manual therapy at the same time, basically, or like mobility and strengthening. It's like, it's going to just say, it's basically gets your patients better quicker at the end of the day.
Right.
That's what I can see this doing.
Yeah,
So.
You save time on treatment. You don't have to do manual therapy and then do the exercise. You're doing both at the same time. And I think one of the best compliments I got yesterday was one of the participants. She's been in the Kaiser system for a while, and she's a little bit burnt out on the edge of like, there's so much patient care and not other things, and she's thinking about getting out of patient care and going into the administrative level of things. And she comes up to us after just day one. She's like, you know what? I'm kind of mad at you guys. I'm kind of pissed because I had this plan and I was going to get out of patient care and go to this administrative role, and I'm so fired up and I don't want to. I don't think I want to now. And that's just like such a compliment and such a great perspective to change. And that's really like my purpose. Like, my why here is not to like teach manual therapy. My why is like, let's get people excited about the profession in a way that they've never had before, right? I'm trying to bridge these gaps of exercise, prescription. Like, my background is strength and conditioning. I was a strength conditioning coach going through grad school. And I want to pair manual therapy always with some type of loading pattern whenever possible. and to see those paradigms like not have to be separate and blend together.
Right.
I think it does empower the person, right, to say, oh, I can be much more efficient. I can actually get there faster and get people excited about things they can actually do for themselves, because you can go to Amazon and get a kit for $15, right?
Yeah.
A cheap, simple, little easy thing, and they could do it for themselves while they're doing their CrossFit workouts, or while they're doing their training with their personal trainer, or on their own home exercise program. So that's what I'm all about, is getting people like to change and shift our paradigm out of like the dependency of manual therapy into the empowerment of manual therapy, right?
Cool.
Yeah, absolutely.
Yeah.
Well said. And,
go ahead.
And I think that's what I think a lot of people in the class were saying. Like, first of all, you had really good reviews from all the people. Right. They always tell us, like, yeah, that was good. That was, you got like almost unanimous, I think, or unanimous. Nobody said anything bad. And also the just to give you another compliment, it's like these are, I would say, a very experienced class.
Yeah.
Like, there's no new physical therapists, and it just happened to work out that way this course. And
these are seasoned clinicians with good, like experiential knowledge that could kind of take cases they've seen in the past and ask questions on it. It was great.
Exactly, and to I think inspire that population to get back in the clinic, and that's what you did. I think that's like a huge feat.
Totally.
The other thing I want to say is, you could tell you did the lecture 250 times or whatever, because the power went out a little bit.
Oh, yeah.
Right.
Didn't skip a beat. You just went off to the second part of the lab. It was just for us as organizers, it was just like such a relief to just have someone that's like can go with the flow so quick.
Yeah. Yeah. Well, I mean, sometimes they fly me out in the NFL to a team, and I don't know what I'm going to get. I don't know what kind of like setup there's going to be. I don't know how many people there are going to be. They're like, you're going to fly in and train our staff or work with a couple players. Like, I have no idea what to expect. So you got to be able to, adapt to any environment and just kind of run with it. And it's based on core foundations and concepts. So like, it's always going to be there for the core concepts and foundations. And the application is going to come in 28 different ways. So, you just got to spin it for the patient demographics that are there, or the type of environment of the learner, right? Am I working with just athletic trainers, or this is a mix of chiros and PTs and ATCs and PTAs? Like, there's all kinds of different groups. And I think you have to know your audience and get to their level. And I think I've been doing this long enough where I've gone through and spoken with enough types of groups where you can really like shift and flex your style to whatever that environment is. And some of that comes with experiential knowledge, but I think some of it is like just being really passionate about what you are presenting and having that background like evidence to rely on with some of that.
Got it. Where's out of all the places you've lectured, what are some that stick out as awesome places?
Highlights? Yeah. I mean, I did Qatar in 2018, and they were building all the soccer stadiums at the time.
Oh, cool.
And that was just such a unique experience. Culturally, the physio world there is so geared towards specifically soccer that anytime I wanted to talk about, rugby or, baseball, we don't even touch because, it's not something that exists out there. But all the other sports took a huge back seat to soccer. Soccer was life.
That's priority.
So that was a really unique experience, I thought. But, I think some of the university settings I've gone into here, there's a lot of burnout in a lot of fields. And I think working with athletic trainers at the NCAA level, Stanford and Duke and Northwestern and Texas, and we've gone all over. And I think you can see when you give someone a new tool that creates this empowerment and creates a little bit of buzz in them reinventing their own practice and being more efficient with what they're trying to accomplish with their athletes or their patients or their clients or whatever. That's my why, like empowering them and seeing like, wow, I don't have to spend 10 minutes of digging my thumb into this hamstring or my elbow into this low back, and they get to actually do things that the athlete can start doing for themselves, and so to present things, I think a lot of times at the athletic training level has been really helpful for them feeling like they can actually breathe a little bit during their massively like packed in day, working long hours. And I think that's one of the other things that really rings a bell of like, I really feel the most satisfaction out of some of those moments as well.
Very nice.
Yeah, I mean, there is something else about this, which I heard you say yesterday. It's like you just pretty much plug and play.
Yeah.
You don't have to lay down or get in a particular position to get these, get the cups on. They can be standing. They can be in whatever position you need, and you're just flexible and you run with it.
Yeah, exactly.
So
I do it on the sideline sometimes. It's a pre-game warm-up thing that some people, some of it's ritualistic, and they feel that sports psychology need of being ready for the game or being ready for this event.
Right.
And you got to be able to do it anywhere. So
yep.
You have to.
Yep.
I think I would say to other people, because you can't get these online at Amazon, but I think it is important to go through the course before you do this.
Right. To understand the why. I agree.
Yeah, and after going through it, I was like, I'm glad I didn't try this like last month or anything, because there's a lot of considerations you have to do.
Yeah,
it's like,
you can do damage if you're in the wrong areas with the wrong pressures for the wrong amount of time. So, I always tell people, like, literally a 4-year-old could put cups on the body. Like, my goddaughter at Christmas will put cups on me, and she's 4 or 5. And, like, it doesn't take a rocket scientist to put a cup on. Like, that's not the skill. The skill is the dosage, the frequency, how often you're doing it, how much pressure, how long you're leaving it on there for, and we're really into the science and the objectivity of it. That's why this new pressure pump is such a game changer. And then also just providing MRI imaging to see what are the effects at different parts of the body with different pressures for different times. So big deal.
So you're basically treating different things based on the pressure. I guess I would be saying, and then also like where, like, maybe lighten off the pressure when you see certain signs and all that. So
but manual therapy needs to grow in that area. The objectivity, it's coming. Like, be excited. Like, the next 10 years should be really exciting to say, this stuff probably doesn't actually hold up, and it's not what you really are saying it is, and this stuff is actually more important than we thought it was. So I'm really excited to be like in the trenches trying to dig at some of those hard questions and provide some data for that. But I do think, us as evidence-based practitioners, we're all trying to find, like I was saying yesterday, this truth, right? And you have PTs starting to do more things like acupuncturists, because we're starting to really take the mind-body connection really important, right? And that's the biopsychosocial component. And you're seeing chiropractors doing a lot more exercise prescription and manual therapy for soft tissues, right? It's not just cavitating joints. It's actually the soft tissues, probably a bigger importance than even the joint mobilization. And then you're seeing acupuncture starting to really feed into actual exercise prescription and movement. So if truth is right here and we're all outside here trying to converge on it, every single profession should start looking more and more like the other ones, because that's what evidence says we should be doing. So, I don't think that's a bad thing. I think it's a good thing, but we all just need to identify that none of us have all the answers yet, and we're all just trying to provide a better evidence-informed platform for them.
Yeah. And then you were talking like about just the profession of physical therapy. Like, where do you see it going?
Yeah, and we're in a crossroads of like trying to define ourselves, and I think it just comes down to cleaning up the muddy water with better evidence. And I've been challenged so much in the last 10 years teaching this, and I don't shy away from those debates, because sometimes I was wrong, and I love learning that. And I think people that have such big egos and like, you have to do it this way, like it's only strain, counter strain all the way, or you only have subluxations and you have to fix these subluxations. Like, those things will wash away over time, and you have to be open to change your mind. If you're not actually reinventing your perspective every 5 years, it means you're not reading literature, And I think PTs are getting better and better at it, but don't be ruled by just the science either, right? The 3 pillars of evidence is what you really have to take into account. And I think if we can keep open minds as a physical therapy profession, I think guiding ourselves towards this multimodal effect of things is really where it's at, because every human being is so unique. So you can't have one way work for everyone anyways, right?
Yeah.
And if we can keep an open mind and still respect the data and understand that science is important, we will grow to a better place, right? But everybody's trying to say, oh, it's, Mosley is saying it's the brain, it's always the brain, and then Saruman's going to say, oh, it's a movement science of the way things work together, and that's the way you have to understand these interconnected pieces, right? And then chiropractors are going to say it's all subluxation, or different views that really have to morph into different things. And I think understanding the multimodal effects are going to be better than the single effects is always kind of, I think, in the back of my mind.
Well, I mean, I think to your point, I think you expand your toolbox, right? And you just got to realize every patient's different, right? They're an N of 1, and Michael Shacklock, he kind of says this.
He
it's an N of 1, and you've got to do what's right for that person, and it's not going to be the same thing every time for every person. Absolutely. Everyone responds differently or has different responses or to different types of treatment. Mm-hmm. So again, this is just another great evidence-based tool to kind of bring into that.
Yeah.
So.
The students appreciate that attitude too. It's just not dogmatic.
You don't want to get caught up in that.
So I think as long as PT understands that we used to teach dogma because that's all we knew, right? And you had gurus that got really cool results. But once you stack that system against other systems, it's kind of a wash, right? You can do either one.
Yep.
So don't get so stuck on a system. Get stuck on being systematic. That's what I like to say. Yep. Is like, systems are great, but if you can be systematic, you're going to see things that are outside that normal bell curve and be able to appropriately adapt to that.
Yeah, there you go. Yeah.
Cool.
Yeah. So, can you tell everybody, like, where do you see your company going, and then tell everybody where to find the company too?
So
like what's coming up.
I mean, Instagram's the easiest way. So at Cup Therapy, we've expanded and we're starting to offer blood flow restriction courses, running mechanics courses. We're going to come out with a fully online concussion management course. So I think there's a lot of holes out there about what to do with concussion. Like, it's great to understand some time frames and things like that, but take a test and actually apply an intervention that's based on this algorithm is what we're coming out with. So it's really going to be helpful for that type of population. So we're shifting into a bigger name. Our new kind of company name is Integrated Movement Health. And so our website's still cuptherapy.com, but Integrated Movement Health is really our umbrella now that oversees all the different type of courses that we're doing. So Instagram's probably the best. Our other new Instagram is at The Strength Therapist, all one word, The Strength Therapist.
How'd you get that handle? That's good work, man.
There was another clinician that grew big and then ditched it because he attached it to his own name. Ego takes over and things, so it opened up and we grabbed it.
Cool. Nice.
So I think there's a lot more to offer in the next 6 months to a year that you're gonna see a lot of new courses from us offered both online as well as in person. So that'd be great. But I hope to teach with you guys hopefully next year again. JetSet's a solid company. If you guys are looking for quality evidence-based practice, this is the place to come and have a great tax write-off. For what you're doing with some traveling. So I really appreciate this experience so far.
This is not financial advice, just so we don't get kicked off of YouTube. You have to say that.
But it's good.
But it is. Yeah. Talk to your accountant. Yeah. All right. Well, thanks for being on there.
Thank you, sir.
Appreciate it.
And thanks for coming out.
Yeah. It was awesome. We had a great weekend. This is one of the more fun ones we've ever done.
Awesome.
So I hope we could do it again next year for sure.
Yeah, we'll find another good spot, and I'll see you guys there.
Yeah,
sure.
And if you're watching this, just put where you want to take Chris's course in the comments.
Check it out. And we'll talk more about JetSet in our other our podcast is What the Cup. We'll post this on there as well.
Oh, okay.
So check out the What the Cup podcast, and we've had Claire Frank on there. So if you want to know more about Claire Frank, she's doing a course with JetSet coming up, and we did a podcast with her maybe 7 episodes ago.
Nice.
So check that out.
All right. Thank you.
Yes.